But under Depression Care Resources, we have the resources dashboard. And the resources dashboard is where we've posted all the CPIC resources. One way to access those resources is by resource alone. So we have resources for assessment. And there is an assessment toolkit that's a little bit more detailed. It includes the assessment algorithms from the clinician manual. And there is a PHQ-9 folder with the PHQ-9 in English and in Spanish. The PHQ-9 really is the screening tool that every outreach worker, case manager, care manager, line staff could use if they're comfortable with. It's not a diagnostic instrument, but it's the most widely accepted screening instrument. It's very easy to use. Anyone understands it. It's also very easy to interpret and score. Under care management, we'll have the care management toolkit, which Esmeralda has gone over a little bit. It has a care manager manual and forms. The forms work for facilitating care coordination with other providers, but also to engage the clients in their own treatment. So clients leave the depression care manager meeting with a form that says, my personal treatment plan, and outlines what they're expected to do. If they are in maintenance, if they've already gone through therapy, gone through medication management, and they feel better, then they receive from their depression care manager a new form that says, my wellness plan. This is how I'm going to keep myself well. And all of this is inside the care manager toolkit, which I click on to download and then save to my computer somewhere.
I want to say something about this care manager toolkits. They facilitate communication across the disciplines. So you can imagine it's probably difficult for a care manager to talk to a doctor. And the doctor, if there's medication involved, or the barrier between a licensed clinician like a social worker or a psychologist or something, and a caseworker. So these forms will give a way to kind of structure that communication which everybody contributes to. So that the physician is the one who puts in about the medication and changes to the medication, and the care manager can interpret those and help explain to the clients, because in that 7 to 10 minute medical appointment, the medication and the changes and how you take the medication might not be explained that well. So another member of the team can use that form to explain it. So I just, it's a way to kind of organize the collaborative care.
And so the next set of resources are patient education or client education, or congregation member education or parent education, depending on who your clients or your constituency are. But the resources are the same. Or maybe even self-care, because, in this line of work, we all experience the stressors that our clients and congregation members and family members are also experiencing. Some of the resources include the Beating Depression book, the Let's Talk About Depression, which is a presentation from the patient education materials, and the 2 brochures you've received along with your bag. The next set of resources is primary care resources, which includes the clinician toolkit. In the clinician toolkit, there's a manual and the quick reference cards. The quick reference cards, I think, are particularly interesting. So I am just going to navigate to it because it's faster here. Middle. Thank you. I think this particular resource is not just for clinicians. I think they can be helpful to anyone in having a quick reference guide to assessment and identifying depression and maintaining. So it covers a diagnostic algorithm, how to educate clients, and how to initiate treatment. Again, it's written in the medical model because it was written for primary care providers, but I think it can be a good resource for everybody.
Can you scroll down to the page 10?
Sure.
This is something we recently added.
And what we did was, well, the doctors on our team, Dr. Chung and Dr. Ong, they added under the different antidepressant medications, you know how there's that new system with like Walmart and the $4 medications. So they referenced the different chains, the different pharmacy chains that are offering those medications, and we starred the ones that, you know, are offered, so that if anybody wants to refer, you know, their clients to a location to get their antidepressants, it's there. It's
not here.
page 10.
It's on the website. Okay, we'll download it from the website. This is from the toolkit.
Okay.
So save it, and then you can see how to open it from a download. I keep my downloads in the downloads folder. A lot of times when you download, it goes to your desktop. And these quick reference cards, they're on the website. If we go down to page 10, it covers medication. And the medication list includes this little sign highlighting the medications that are available in the $4 a month formularies. Is everyone familiar with those $4 generics? So some national chains are now selling a select number of generics for $4 a month. And this is a lot cheaper than what we would find at the national chains, where most people who are covered with insurance would buy because their copay is low. So it basically brings the cost of those generic medications to a lower price to most folks than it is with insurance. So we think it's a resource for folks working in the community who may be helping uninsured folks, which so many of us are.